I'm going to start off really where I've started the last few times with this slide as a reminder, because I think we're really now seeing what's been predicted all those weeks ago really coming true. The prediction was over time, VOCs would start to go up and up and up. The non-variant cases would come down, and the overall pattern would be, it would look like we're coming down, we'd flatten out, and we'd start to go up because the overall pattern would hide what was happening with the variants. And I think we've more or less seen that, but perhaps it's actually a little bit worse. So absolutely here, this is the Ontario Science Tables dashboard. It shows the variants going up as expected. The non-variant cases were going down and they sort of flattened out, but where it's worse is actually we're now seeing the non-variant cases going up a little bit. You can see this data is only until April 1st. If I draw in what it looks like since then, you can actually see things have started to pick up quite sharply, even with the non-variant cases. So we already have our non-variant cases going up. When you layer in what's happening with the variants, you can obviously predict that we're seeing a very sharp increase of cases right now. I note that we are at this point, getting very close to the peak of the second wave. Probably within a week, we will be past the peak of the second wave. So unfortunately, I expect the third wave is going to be larger than our second wave as a result. Taking a look here at what things look like in Niagara then. Similar pattern with our non-variant cases where we've for a while been seeing them going up, and the increase in those cases is now accelerated, consistent with it increasing with the province as well. And then when we add in our variant cases, you can of course see we're even higher. The gap there is of course a contribution of the variants, which is actually less in Niagara than it is on the province as a whole. But we are still seeing the pattern, and we're probably halfway now to where we were at the peak of our second wave. So that's where we're at so far. I want to discuss a little bit about what we can expect in the coming weeks. So this is what the Ontario Science Table put out end of last week in terms of what their modeling shows. And so this is, our cases, the second wave peak. We came down, we started to go up again. And they're showing that if we did absolutely nothing, this is the trajectory we'd follow, and the cases would keep going up and up and up on an extremely high level. Of course, we are aggressively trying to vaccinate in Ontario to try and keep cases under control. And that actually changes our trajectory to this red line. So we don't go up as steeply because some people are going to be protected from getting infected. But that still means that we are going up. By the end of April, the province would be doubled in terms of the number of daily cases from the 3,000 we're seeing right now, closer to around 6,000. It was only, according to them, with the combination of vaccination plus a stay-at-home order type lockdown that we would see cases peak by mid-April and then start to come down from there. And then if you did only a 2-week stay-at-home order and you lifted the lockdown, of course, cases would resume starting to go up. If it's 4 weeks, you buy yourself a little bit longer before you lift off the lid from the pressure cooker and allow things start to go up again. I think the key here for me, though, is that we can expect a couple more weeks of cases going up before we really start to see the impact of the provincial lockdown. So we will see cases go higher. And of course, once they go up, when the lockdown starts to work, it's going to take time for the cases to come back down. So we can expect cases, a month from now when the lockdown is lifted to perhaps be not on dissimilar to where cases were last week. So we'll have basically bought ourselves a month, but we won't necessarily have lowered cases. And then we'll be in a situation where perhaps the cases start to go up. But this modeling here was all assuming the province would do a stay-at-home order. And of course, the province has not done as strong of a lockdown as that. And so when we do see the impact, I think we may see that the cases don't come down as quickly as has been modeled here. And it is quite possible that a month from now, we could still see cases higher than where they are right now. And I think there's a good chance the province, once they get a month from now, when they're at the point of having to decide on extending the lockdown, they may need to actually extend that lockdown. We saw in December, the plan was to do a 1-month lockdown, and as of 1 month, it was extended. It wasn't long enough. The province back in March of last year initially announced a 2-week lockdown and then kept renewing it by 2 weeks because we saw cases hadn't come down. And I think we're probably in store for that this is not going to be a 1-month lockdown. because the cases won't be really back down there. It's going to unfortunately need to be longer than that. Now, the thing that I think really ended up pushing the province to move ahead with the lockdown was really our hospital partners speaking up loudly about the intensity of what they were seeing and how hospital beds and especially ICUs are filling up. I've talked in past weeks about how we are seeing field hospitals being built in Ontario. This is what the Ontario Science Table has shown in terms of ICU capacity. And so, we peaked a little over 400 in the second wave. We had come down to maybe about 300, but had then been trending up. And now we're, of course, past that 400 mark from the second wave. And similar to cases, there's going to be a couple of weeks, perhaps 3 weeks, before we actually see our cases in ICUs peak and start to come down. And the modeling here says that we could see a doubling of our number of ICU cases. And then by the end of April, because ICU admissions is a lagging metric compared to cases, it's quite possible we would still be at that very high level of ICU admissions, even a month out. And so I think this is another reason why I suspect we are likely in for a longer lockdown than just a 1 month, because ICUs are going to be at a really critical level a month from now, and we're going to need to stay in lockdown quite a ways longer before we actually see our cases come down. Just to show you another, graph here showing where hospitalizations and ICU cases had been doing until the end of last week. This is by the Ontario Science Table, and of course, I just showed how the modeling shows that's going to keep going up. And just to give you a sense of the, spectrum here, we're already seeing a fairly sharp increase in those hospitalizations even in this last week. And, you can expect that as the cases have come up near the peak of the second wave, we're probably a week away from hospitalizations reflecting something similar. And ICU admissions that I talked about have already reached the point of where we were at the end of the at the peak of the second wave. So I think that is what we are in store for the next month or two, that we are likely seeing the lockdown extended a month from now until we're really able to get a handle back on hospitalizations and ICU admissions. Now, last week I talked a little bit about what we are seeing in terms of the different variants in Ontario. And I particularly talked about the P1 variant, which is the variant in Brazil, and how in the BC, they actually have a very large outbreak. BC is actually now the #2 hotspot in the world. Brazil, of course, is the #1 hotspot with this variant, and now BC is actually emerged as the second one. Alberta is also seeing an outbreak of this variant. And, I talked about how I'd seen a big jump in the number of cases in Ontario from that variant over at that last week, where you can see it, more than doubled within that week. Looking again this week, it's gone up by another 50%. So that's good news that we haven't doubled again, but it is actually rising quite sharply. In this last week, we've had another 24 cases of that variant, which was almost what we had seen until, the early part of March. So this variant is, I think, one I'm going to pay attention to, because there is a risk that we could see it certainly starting to go up, especially since it's in other parts of Canada. And particularly this variant is notable because it is the most severe in terms of the illness it causes. So that would put even greater pressure on our hospitals and ICU beds. And this is a variant that is most resistant to our vaccination. So we'll get the least benefit from vaccination if this variant starts to spread more widely in Ontario. All of the modeling we've done is really focused on assuming that this variant, the B117 variant, the one that was identified in the UK first, that is really the dominant variant. Now, with cases having gone up so sharply across the province, it is really reaching a point where we are overwhelming the ability of local public health to do really fulsome case management and contact tracing. I just want to show you what our weekly metrics here were. And you could already see here that the percentage of cases that we were managing to follow up within 1 day was already actually starting to fall and was below that 90% threshold. Our contacts really throughout the last few weeks have actually been below that 90% threshold. We'll release our next set of data next week, but I imagine you're going to see that these metrics have continued to worsen given our cases continue to go up. And the other part I think that's not shown by these numbers is this follow-up that's really fulsome and thorough, and then this follow-up which is much more cursory. And right now we're doing a much more cursory follow-up to keep the numbers as high as they are, we're not doing the kind of fulsome follow-up we might have been doing at the start of March. And that means that contact tracing is going to be less effective at keeping a lid on cases. And I think that's one of the reasons why we're seeing that sharp increase in cases, is because across the province, we reached a point where we're not able to follow up with our cases with the same intensity, find their contacts with the same rigor. And so we're not seeing the benefit of contact tracing helping us keep cases low. We're also now in a point where if hospitalizations are up, ICU admissions are up, we're trying to deliver more vaccines. A lot of our healthcare workers are being pulled towards those activities and away from really doing contact tracing. And that's unfortunately making it even more difficult to really use this as our way of staying on top of cases. And that's one of the reasons why I think many of us argued that back in February, we should have been more cautious about reopening, so we would make sure we didn't outstrip our ability for contact tracing to keep things under control. Last thing I really want to talk about today is just look a bit at the age pattern of what we are seeing with our cases here in Niagara. So, starting off, we'll take a look at that under 20 age group. You can see this was the first wave, which barely shows up. The second wave was much more significant, and this third wave, we're already seeing that young age under 20 group basically meeting this peak of the second wave. I think through the second wave, we were perhaps not picking up all of our cases because the province had the system where you could attend school unless you had multiple symptoms. Unless you had multiple symptoms of COVID, you didn't need to be tested. If you just had one symptom, such as a runny nose, sniffles, that wasn't enough to be tested. That has changed with this newest, since schools reopened in February. So I think we are picking up cases in school-age children more. And so we're seeing a better reflection of what might be happening in our schools. You've no doubt seen that lots of schools have cases. We do have a few school outbreaks, and I think you can see this increase in cases is really a reflection that we are seeing cases in school-age children and some transmission in schools. A lot of these cases are acquiring it through their household and their family as opposed to at school, but we are definitely seeing some outbreaks in school. And of course, in Peel region, where they have double the cases in the community and have had for quite some time, many more cases in the community, they've of course had to take more drastic action to try and address what they're seeing in schools. The next age group here is a 20 to 39 age group, and this has been the age group that has long dominated spread of infection, and we can see how much higher they were in the second wave, and we can see that they are increasing sharply right now, rising much more quickly than we're seeing in that less than 20 age group. And I think that is in keeping with what we've seen as that group being a big driver of spread in our community. In many cases, I think that's because they're working service jobs and they're working jobs where they aren't able to stay at home. So they are a group that, through no fault of their own, is at more risk because they happen to work in that sector of the environment, of the economy. There are perhaps, though, some who are maybe less diligent about following some of the public health recommendations about staying home and not socializing. And I think a combination of those two factors is leading this to be a very big group in terms of the spread of infections. Then taking a look at some of our other age groups, the age 40 to 59 age group, we can see they're trending up, and they're trending up similar to the under 20 age group. So I think that's consistent with lots of children are getting infections from their household and their parents. And so we're seeing as the age group of parents is going up, the age group of children is going up similar to them. The age 60 to 79 age group, I think we're seeing a bit of good news here, where they were maybe more similar to the 40 to 59 age group in previous waves, and they're quite a bit less this time. Here if you see there's maybe 20% less, whereas now you could say they're a good 40% less. And I think that may be a reflection that we are vaccinating the 70 to 79 age group. So half of this age group is starting to get vaccinated. We may be seeing some of the impact of that, in that cases not rising as quickly in this age group. And then of course the 80 plus age group is our last age group, and this is the age group where we've done the most vaccination. And you can see how they were very close to the 60 to 79 age group in the second wave and even in the first wave. But in this most recent wave, we're seeing actually quite low numbers of infections, 80 plus age group. And I think that's directly a result that this is the age group where the vast majority has actually now been vaccinated. They're protected from COVID-19. And so we're not seeing that same increase in cases in that age group. And so I think there's a good news here with these last two lines showing what the impact of vaccination has been. just to show you what the vaccination percentages are, with that 80 plus age group in Niagara, we're now just under 88% of that 80 plus age group vaccinated. And that's, again, why we have so many people vaccinated that we're not seeing a lot of spread within that 80 plus age group. We're seeing pretty good progress with the 75 to 79-year age group. Vaccinations opened up to them only 2 weeks ago, and we're already almost at 70% of that age group is vaccinated, so we're making good progress there. The 70 to 74-year age group opened to vaccination just a week ago, and we're almost a third of that group has been vaccinated as well. And overall in Niagara, we're now up to about 16.7% of our population is vaccinated, which is up a good, 4 or 5% over the last week. And so we're making good progress. And again, these two age groups here, the 70 to 74, 75 to 79, 80 plus age groups, where we're dealing with vaccination is really why I think we're seeing the relatively slower rise in cases in those age groups, because vaccine is really helping us out. As much as this is good news, these are our smallest age groups in terms of the number of people in our society who are in those age groups. We have far, far more people who are in the 20s, 30s, 40s, and 50s, and even in the 60s, and we aren't vaccinating those age groups yet. And so it's going to be a long time, I think, till we see the same kind of benefit we've seen in the 80 plus age group to some of these other age groups, which is why I've talked a lot about how we're going to need to get through, at least until the end part of May before we start to see the impact of vaccination really changing trajectory of cases overall here in Niagara and in Ontario as a whole. So with that, I'll turn it over to questions.
Okay, thank you, Dr. Hergy. So up first, we have Ludwig. So let me allow you to unmute. And here we go. You should be able to unmute now.
Thank you, Meredith. Hello, everyone. Hope everyone had a great Easter long weekend. Dr. Hergy, I was just tapping into the federal update on the pandemic that was just running right before we started this meeting here. And I hear a lot of questions around the Brazilian variant. There seems to be a slightly less confident tone with the vaccine, as you alluded to, than perhaps what we've heard in previous weeks. In regards to what you're seeing with the Brazilian variant, what would it mean if it would make its way here? And what is the risk of this strain becoming sort of dominant in the Niagara region from your perspective?
Yeah, so I'll maybe start with the second part first. I am fairly hopeful that it won't become the dominant strain, just because I think the UK variant, the B117 variant, has really emerged as that dominant strain, and it has such a big head start. I think it's probably going to crowd out the P1 variant from ever really having the opportunity to be that dominant strain, at least in the near to medium future. There is a scenario, maybe a year from now, where vaccination is so suppressed the B117 variant, but hasn't suppressed the P1 variant as much that the P1 variant starts to emerge as a more dominant variant. But that would be in the context of a vaccinated society, where I think it wouldn't be as overwhelming as it is now. So I think there's certainly at least some hope that we won't see it become a dominant strain. But I think what we could see is it becomes significant enough of the number of infections due to that strain that it's going to have a real impact. This strain is more transmissible than normal COVID. I'm not sure it's necessarily more transmissible than the B117 variant, but it's again another strain that's going to be harder for us to control. And we've seen over the past 6 weeks how hard it has been to control variant cases. But this is a more severe infection. And so I think we could potentially see even more young people and younger people getting hospitalized, potentially unfortunately passing away. And that's the real danger, I think, of this variant, is that we could see more severe illness. We could see it putting more pressure on our hospitals if large numbers of people start to be infected with this variant. And then, as you say, if the vaccine is less effective, that means that once we're getting into May, June, and we have a majority of our population is vaccinated, instead of being able to recalibrate as strongly and reopen as much as I previously talked about, hopefully we would be able to do, that variant might mean that maybe we can't quite go to quite those same lengths of reopening. And we'll recalibrate, we'll reopen somewhat, but we won't be able to have as aggressive or as fulsome reopening as maybe we'd hoped. I was really hoping that, by the mid to later part of the summer, we could start to see things looking very similar to what they were last summer, where most things are open. There's a fair amount of freedom. And I think the P1 variant could maybe put a damper on that, where we would still have to be a lot better off than we are now, but we would still be in a state of vigilance.
And a follow-up, Ludwig?
Yes, thank you for that. My second question is also, you showed a pretty drastic curve showing the 20 to 39 age group contracting COVID quite a bit here. I'm just looking to hear what you've been seeing in terms of the boots on the ground angle, if you will. Have you seen severe illness among young people here that you perhaps would not have expected, or at least not seen in the same extent in the early days of pandemic here in Niagara? Because we know that the UK variant obviously is has been reported to be more infectious, and also in some cases seems to be rendering a different set of severe symptoms. So I'm just looking to hear, have we seen severely ill 20-somethings here in Niagara?
Yeah, fortunately, I don't believe we had any severely ill 20-somethings who needed to be hospitalized. I think the one caveat to all of this is that our cases in Niagara were fortunately not very high until really the last couple of weeks. So we've not had a large number of people who are at risk of being hospitalized. If we're seeing in Niagara, it's maybe 5 to 10% of people at the very most who need to be hospitalized. If you're seeing 30, 40 cases a day, that's maybe 1 or 2 being hospitalized in a young group. Very few of them would be that group. So I think we've not seen enough volume. We have anecdotally seen, a fair number of people in their 40s and 50s being hospitalized, which does feel like it's a bit higher than we've seen in previous months. So it has migrated, I think, in terms of severity to that age group, but not quite as low as the 20s and 30s yet. But, we'll have to see what we see in the coming weeks if we start to see hospitalizations at a much younger age group.
Okay, thanks, Ludwig. And Stephen from Cogeco, you're up next.
Stephen's talking, he might be muted, so.
Should be able to unmute now, Steve. Okay, we'll come back to you. Okay, Gord Howard up next. Let me see if I can unmute you. You should be good to go, Gord.
Oh, thank you. Good afternoon. Dr. Hergy, I wonder, in the past few days, we saw the medical officers of health from Toronto and Ottawa and Peel publicly call for the stay-at-home order to be added to the shutdown that we're in. Do you agree with that, or have you been urging the province to do the same thing, maybe not as publicly as them?
Yeah, so as a group of medical officers of health, the Council of Medical Officers of Health of Ontario, we did actually write to the Premier in the province at the end of last week, urging for stronger measures. When I look at the modeling here, particularly maybe actually the ICU modeling here, we can see that with the modeling, even with a 4-week stay-at-home order, we, the ICU admissions, the 150 threshold was the worrisome threshold the province set. We're already at 400. We're going to get to 800 by the end of the month and not even have the opportunity to come down. And that's with a stay-at-home order. Without that stay-at-home order, I think there's a good reason to think that we are actually perhaps going to be even higher than that. And so I would absolutely agree with the recommendation that we should have gone to a stay-at-home order. The science table shows that, even with that level of intensity, puts us into a pretty dangerous state with our hospital and ICU admissions. And we should be doing at least that much, I think, in terms of getting a handle on what's happening here.
And a follow-up, Gord?
Yeah, also, we learned today that the teachers with the Catholic and public school boards can start receiving their vaccinations. Are you going to be able to roll those into the clinics you've already got scheduled? And I guess 1 or 2, when did they tell you that the teachers would be allowed to start receiving them?
Yeah, so the province, when they put out their phase 2 priority groups for vaccination. Teachers and school staff were actually one of those groups. At our community task force for COVID-19, a decision was made to really make sure that they were near the front end of phase 2, given that we're seeing a fair number of cases, many outbreaks in schools, and we all want to prioritize trying to keep schools open as much as possible, and vaccinating this group would support that. The current plan is that the school boards are working with Niagara Health to see if they can get into that vaccination clinic with some dedicated dates for that. So they wouldn't necessarily be part of the provincial booking tool, but would rather have dedicated dates to Niagara Health Seymour Hanna Clinic.
Okay, thanks, Cord. Bonnie Heslop, you're up next.
Hi, guys. My question is about that letter that you just mentioned that was sent to the Ontario government last week. Could you tell us a little bit more about that? Which kind of measures would you like to see put into place that are not already?
I would feel that we should try at the first instance, replicate the previous 2 lockdowns we've had. We know those 2 lockdowns have actually worked. And so as much as possible, it would, I think, make sense to mirror those. Key to that is, we have retail still open. There was lots of pictures on social media this weekend showing malls around the GTA that look fairly busy. And I think that is a big difference between this lockdown versus the previous 2 ones we've had in Ontario. And I think as a first instance, really tightening up those rules. Let's actually keep the same things closed that we had in the previous lockdowns to make sure we see the same benefit that we saw in those 2 lockdowns. Stay-at-home order was part of the lockdown we had in the second wave, and the province particularly brought that in when they weren't seeing enough impact of the initial lockdown. And so I think that would make a lot of sense again. The stay-at-home order was a useful tool that really enhanced what we saw, and we should go with that. Then I think it's a judgment call about, do you want to try and bring cases down faster because hospitals and ICUs aren't going to be able to handle the influx that we're seeing even with these predictions? If that's the case, we should start looking at what's been done in other provinces where, BC, for example, has a curfew. In other countries, they have restrictions that people can only leave their home within a certain radius unless they can show that they're going to work or something essential. Some places actually require you to, send a text message to a central address and get a pass for giving you permission to be out of the house for a few hours. We could start looking at those sorts of measures if we felt there's a need to be even more intense about our lockdown. But I think in the first instance, let's at least get our lockdown to mirror the previous 2 lockdowns that have been effective, and probably also add the stay-at-home order, because the Ontario Science Table has shown that's, at least what we can predict is going to get us to these levels. And then we can have a conversation with our hospitals about whether they can manage getting them to 800 ICU admissions, for example.
And a follow-up, Bonnie?
Yeah, thank you. Did you include a recommendation to close any schools as part of that letter?
I don't believe we did include that. As COMO Group, the Council of Medical Officers of Health, we've really taken the position that schools are essential, that we want to try and make them the last thing we would close and try and keep them open as long as possible. And so we're not necessarily looking to close schools at this point. That would be something though to consider if all the other measures and closing everything else wasn't bringing cases under control.
Thanks, Bonnie. Paul Forsyth, you're up next.
Can you hear me?
Now we can.
Oh, good, thank you. So Dr. Hergy, your chart showed the older age groups, I think it down to 65 possibly now, the curve going not nearly as high as the younger age groups. So that's obviously proof. I mean, it's an obvious question, but I'll ask you anyway. Is that proof positive that these vaccines are most definitely working?
I wouldn't necessarily say it's proof positive, but I'd certainly say it's additional evidence that these vaccines are working. The populations where we vaccinated, we're seeing cases rise less quickly, certainly less quickly than we saw in the previous 2 waves. And the group where we had the most vaccination, the 80+ group, we're seeing that effect even more intensely. So yeah, absolutely. I think this is additional evidence that the vaccines are working.
And a follow-up, Paul?
Sure. So we're now rolling out the pharmacy vaccinations across Niagara. I've heard some pretty positive things. I mean, anecdotally, how do you think that's going so far?
Yeah, anecdotally, what I've heard is so far it is going well. I think having more locations where people can get vaccinated obviously improves access for everybody and is going to hopefully make sure we get more people vaccinated. I think the other good thing about the pharmacy vaccinations is the province has actually put a lower age threshold on that, where it's as low as 55 and up. And so that actually allows a greater group of people now to be able to get the vaccine, which is, I think, also very positive. I just want to also flag that on our website, we are now reporting out the number of vaccines delivered by pharmacies as well. So you can see how many vaccines they're delivering every day.
Thanks, Paul. Up next, we have Penny Coles. You should be able to unmute now.
Okay, thank you. I know that that it would be complicated, but I'm wondering, when you can so clearly see that it's younger groups of people and their activities, such as the jobs that they have to go to, where the increase in cases is coming from, whether it would make sense to start looking at, instead of just relying mostly on age, looking at essential workers and targeting vaccinations to the people where the spread is actually coming from.
Yeah, no, I think there's definitely some logic behind that for sure. You know, there's a tension here about our elderly age groups are the people who've been at greatest risk of dying from COVID-19. Do you want to vaccinate them to stop people from dying, or do you try to stop the spread in hopes that that will indirectly save people from dying? I think the 20 to 39 age group, or even if you're doing the 20 to 29 age group, that is a very large group of people. I don't have the number offhand of how big it is, but it's definitely larger than, say, the 80 plus age group. And so I think there's some logic that you start off with the eldest age groups because you're going to be able to get all of them vaccinated pretty quickly. And then maybe you pivot over to doing those essential workers, people who can't, who are most responsible for the spread of infection, when you have more supply of vaccine and you already have the people at greatest risk of dying protected. So I do think there's a lot of logic that in the near future, maybe we should be pivoting from continuing to work down age groups to pivoting maybe to vaccinating these groups of people. I think one challenge is going to be the logistics of how do you identify and validate these people are the people who continue to need to work from outside of the home and are at risk of spreading infection. One of the easy things about age is it's very easy to validate someone's age. The province's booking tool looks at your health card. It's matched to your birth date. They know if you're within the age groups that can be vaccinated or not. Figuring out if someone is a grocery store clerk, or if they work in a pharmacy, or if they work in some other business that's essential, but where people need to work outside of the home, validating that is going to be a bit more of a logistical challenge to be able to make sure we're vaccinating the right people and people aren't sneaking in by falsifying who they are.
And a follow-up, Penny?
Okay, this is a very, very specific question, but it's one that came up in the last few days, and that is people who are recipients of transplants and other people who are at very high risk because they are their immune systems are highly compromised. Is there some way to allow them to skip the age group and get a vaccination because they're at very high risk?
Yeah, so the province has said that as we get into phase 2 of vaccinations, people with high-risk chronic conditions, and I think some of the ones you've mentioned, would all be included there. The way we would probably do that, again, with the logistics of how do you validate that, is probably through people's normal healthcare provider have them vaccinated. So if people are regularly going to a hospital clinic, the hospital could probably organize vaccination through them. And I think in some ways, the hospital has actually already started to take steps in that direction. If people are immunocompromised and on dialysis, I think that's one group the hospital is already taking action to vaccinate. The other way we'll get to them then will be through their community healthcare provider, particularly their primary care provider, who likely would see these people fairly often. And so I think as we get vaccines now available in primary care and get primary care up and running, I think as we enter phase 2, there'll be the opportunity for primary care to start vaccinating that group.
Thank you.
Thank you, Penny. I just noticed that during this call, the province has sent out a media release around moving to phase 2 that includes details about organ transplant recipients. So if you subscribe to the Ontario media releases, there might be some more useful information in there.
Okay, thank you.
Yeah. And then finally, we have Richard Harley. Let me find you here so you can unmute. There you go, Richard.
Hey everybody, how's it going today? So I'm wondering if we have an idea of how many people are choosing not to get vaccines and why, and what kind of messaging the region's putting out to encourage people to get vaccines, and how media might be able to help with that message as well.
Yeah, no, that's a difficult question to answer because people typically don't come and tell you that they're not going to get vaccinated. If they want to be vaccinated, they sign up, and we don't know what's the deal with everybody else. What I can say is, at least with the age groups that we started with vaccinating, we're not seeing a lot of evidence that people aren't choosing to get vaccinated. With the 80+ age group, as you can see here, we have 88% already vaccinated. I think in the public health clinics, we have about another 6% or so already booked into clinics. I don't know what Niagara Health has, but that means we're going to get to at least 94% of this age group within the next week or so. So I think we're not seeing much evidence in this 80+ age group that they aren't going to get vaccinated. The 75 to 79 age group, I think, is a similar story here, where we have close to 70% already vaccinated. We have another 16 or so percent of people in that age group actually booked into a public health clinic. There's probably more booked into Niagara Health Clinic. So we're looking at getting to 85% and above of that age group pretty soon. So again, it doesn't seem like there's a lot of people in that age group who have not signed up for vaccination. Where we start to see maybe we're not seeing as much uptake yet is with the 70 to 74 age group, where we've got about a third of them booked in for a clinic. About another 20% of that age group is booked into a public health clinic. Possible many more booked into Niagara Health or elsewhere, but that's the age group where we don't have as much line of sight of whether or not most people are already booked into a vaccination clinic or not. I think as we go through the next couple of weeks and we work further through that age group, we might get a better sense of where they are and if they're mirroring the 80+ age group, or maybe something closer to the 75 to 79 age group, or if they're going to be different and we're going to actually have a substantial number of people there not getting vaccinated. I think with most vaccines, though, we see a trend where people who are older tend to have more trust in vaccine and are more interested in getting vaccinated, perhaps even just because they're at greater risk if they do get the infections. We see in long-term care homes where basically every year we get close to 100% of people getting flu vaccine. But if we're looking at the community at large, it becomes 25 to 30% of people get flu vaccine. And so I think the real test of whether people are willing to get vaccinated is going to be once we get to younger age groups. The middle age groups, the young people in their 20s and 30s, are they choosing to get vaccinated or not? And I think at that point, we'll know if we're running into a lot of resistance. And if we are, I think at that point, we have some plans for what we could do in terms of campaigns to promote vaccination more, and we would head down that road. Right now, I think our push is really to make sure that the age groups who are eligible for vaccination, and particularly the 70 to 74 age group, knows how they can go about getting registered for vaccination, so we can start to see the number of bookings up, and we can feel confident that they're in line to be vaccinated. And if we see they're not, then maybe they're actually the first age group where we need to promote vaccine a bit more.
Do you have a follow-up, Richard?
Yeah, you mentioned, you mentioned radius restrictions and curfews as a possible deterrent measure. Is that something that's being looked at that you're recommending for heavily tourist regions in Niagara, like Niagara Lake? I know our talking to our mayor this morning said she kind of, their hands are kind of tied, and they last summer tried a bunch of different things like stopping parking, closing washrooms, which led to obvious other public health concerns. So is that something that the region's looking at doing? And if not, like, are there any plans to try and address quite a heavy traffic coming into tourist areas?
Yeah, it's not something that we're looking to do ourselves. It's really outside of the powers of us as a public health department to stop people from traveling into the region. We don't have the ability to do that. I think if we were going to have inter-provincial travel restrictions, that would have to be something that the province would do. I think it's something definitely worth looking at. We've particularly seen with our mobile data that we have a lot of people from outside of Niagara coming into places like our tourist areas, coming to do some of the shopping in our areas. Even, a month ago or so, when the parts of the GTA were still in a stay-at-home order, we started to see people from the GTA coming in and doing their shopping and doing their recreation here because things were open here and were probably actually better than what they would be in Toronto anyway. And that's the kind of thing that I'm hoping we don't see. I don't think it's a surprise that we see cases go up in places like the GTA, we see cases go up in Hamilton, and then they start to go up here in Niagara later. And that's probably because cases go up in other regions, people travel here, and the infection starts to spread. So I do think looking at some kind of interprovincial travel restrictions might make a lot of sense for us here in Niagara, but it'd have to be a decision made by the province.
Okay, thanks everyone. I've just put a message in the chat. If anyone would like to ask another question, can you just let me know in the chat and I will unmute you.
We did skip Stephen when he had his audio problems.
Yes, he messaged me saying that he did not have any questions.
Great.
Okay, Gord, I will unmute you. Give me 1 second here. Here you go.
Sorry, I'll start again. It's a question about outbreaks. We're seeing more in long-term care homes again. I think it's 8 today. And given that they've been fully vaccinated, I wonder how that happens. And also which variants have been causing many of the outbreaks that we've been seeing.
Yeah, the thing about a vaccination is that no vaccine is 100% effective. With the Pfizer, Moderna vaccines, even with 2 doses, the estimate is that they're about 94% effective. So there's still some risk that people can get infected there as well. We know that not every staff person has been necessarily vaccinated. Most staff people only have 1 dose of vaccine rather than 2. Family members who might be visiting, hopefully they've been vaccinated, but some maybe have not. And again, if they have been vaccinated, they've only had 1 dose. So there's still potential for a lot of people to get sick from COVID-19, even if most people have been vaccinated. What we're seeing with our outbreaks, though, is that where in the past, we had outbreaks where we'd have 100 people, or in some cases, pushing 200 people getting sick. We're now seeing outbreaks where I think the largest outbreak we have is 4 people are sick in that outbreak. Many of our outbreaks are actually just a single case of infection. And we're seeing outbreaks don't last for months and months, where we've seen some outbreaks in the past do that. Now our outbreaks really seem to be about a 2-week affair, and then they are really actually able to come to an end. And I think that's what the vaccine has done. It hasn't meant that we've prevented outbreaks completely, but it has meant that when we have outbreaks, there's small numbers of people getting sick. We're able to control them really effectively and end those outbreaks pretty quickly. And I think that is a huge testament to what the vaccine is doing. And then the other part, of course, is that even where maybe residents still are getting sick occasionally from COVID-19, the vaccine is at least preventing them from being severely ill. So they're not being hospitalized. They're not unfortunately passing away. So that's another benefit we're seeing from the vaccine.
Okay, Ludwig, you have another question?
Great. Yeah, thanks. I was just looking to see if this week, Dr. Hood, did you have any insight into the local situation here in Thorold? I think we're still number 4 among the municipalities here in terms of known active cases. In other municipalities with perhaps comparable size, their numbers are not nearly as high. So I'm just looking to see if you have any sort of insight in what's going on here. I know a few weeks ago you were talking about a cluster of households that you had identified as having social gatherings as the sort of what would you say, the center of the caseloads here, or at least 40%. So I'm just looking for some clarity there if you have any. Thanks.
Yeah. Ludwig, I'll need to take a double check if there's anything new there, but most of what we're seeing is really a continuation of what I communicated to you last week. We have that one social cluster of many people who live in Thorold having had social gatherings, and unfortunately the infection is spread quite widely through that group and through their extended households as a result. And then as well, I think the proximity of Thorold to Brock University with many students in an outbreak there, I think we're seeing a little bit of contribution from infections from that outbreak in terms of some students who might be living in the Thorold area. I'll follow up after this conference with any further details if there's anything further to add.
Okay, and final question goes to Penny, and I will unmute you. There you go.
Thank you. I just wondered, since we're all kind of waiting to see what Doug Ford is going to do in the next few days, whether there's going to be a stay-at-home order or a change to the lockdown restrictions, whether you as a group got any response to the letter that you sent calling for more restrictions.
No, we have not had any response to that letter that I'm aware of yet.
Okay, thank you, everyone. So again, sorry for the technical issues at the beginning. I hope that by next week I have my own Zoom account and everything will be fine. So thanks for your patience. And if you do have any additional questions, please email them to Courtney and me, and we'll do our best to get a response from Dr. Hergy. And with that, I'll end the teleconference, and I will see you all next week.